Good afternoon, everyone. Thank you for being here. Good to see everybody. Why don't we get into some data, talk about a couple issues, answer some questions. Still a lot of unanswered questions related to restart at this moment in time. Unfortunately, we have lost two neighbors in the hospital yesterday. Both were Caucasian females, one in their 90s and one in their 70s. Certainly, like all of our neighbors in the county that we've lost in this process, we're very sorry for them and their families. It's tough to communicate in these times of COVID, very difficult to grieve, and certainly let's remember them and remember everybody we've lost in this pandemic. Just very painful. We now have 130 neighbors that we've lost in this pandemic overall. Certainly, when you look at where we are as a community to others, we've done better. But the fact that we're talking about the loss of life with 130 people in the sense that it's good compared to other communities just highlights how vicious this virus has been. Related to testing, there now have been 33,720 tests administered, 32,612 tests have been returned, 695 tests since yesterday. There are now 1,992 positive cases since March 16th, 19 new cases today. We'll get into those in a minute. 30,620 negative results. We sent 1,431 tests yesterday. We have 938 pending tests. 6.1% of the results we received are now positive. That number is going to continue to drop as we are testing anyone. Remember, in the beginning of this process, when we were doing symptomatic testing only with a little bit of proactive testing, where we were proactive testing areas where the virus had been, we were about between 8 and 8.4%. Now we expand testing, that number comes down each day. Our 3-day average off of the ECLAIR system, the New York State Department of Health system, the last 3 days they've processed 889 tests essentially a day in the ECLAIR system. That's the average. You take our positive cases over the last 3 days against those, our infection rate 3-day average is at 2.7%. So infection rate going in the right direction. Universal testing at our triage testing site, Syracuse Community Health Center on Salina Street. That's been open every day. We'll continue to keep that open. In addition to that, we have been doing mobile testing, going to you in your neighborhood and the community. Yesterday, we did 250 tests at Lafayette High School in our southern towns. Excellent testing day. Today, we are at the Syracuse Community Health Center East location at 1938 East Fayette Street. Tomorrow, we will be testing in the Valley Plaza on South Salina Street. Monday, we will be at the Clay Central Park on Wetzel Road in Liverpool. So we'll be in our northern suburbs on Monday. Tuesday, we will be at the West Genesee High School. I want to thank the superintendent there for helping us with that. So we'll be in the town of Camillus, West Genesee. Thursday, we will be going east to the Immaculate Conception Church parking lot in Fayetteville. And then Friday, we are back in the city of Syracuse at PSLA Fowler High School in Syracuse. I want to thank the mayor for helping us with that, Superintendent Elisea, Mayor Walsh. They are in the midst of a fantastic athletic construction project there. So everybody can go and see the progress there and get tested for COVID. So a lot of mobile testing going to all these locations. As a region, daily goal, 775 tests as a region. I want to thank our partners, Chairman Hyder of Cortland County, Chairman Becker of Madison County, Chairman Weatherup of Oswego County, and Chairwoman McNabb Coleman of Cayuga County for all of their partnership in this. Couldn't ask for better partners than them. Yesterday, another great testing day, 1,626 tests in the region. Daily average 1,284 from May 21st through May 27th. Clearly beating the metric, which is important related to restart. Hospitalizations, 77, the number still. 44 of those individuals, folks that will be transitioned out of hospitals. We are working on 2 different locations that can be transition facilities for individuals who have yet. These are individuals who go into the hospital, they lived in a nursing home, they go into the hospital, they're sick, they get better, need to go back to their home. Governor has an executive order saying you need to test COVID negative to be able to go back to the nursing home, which is their home. As we know now, you don't just test COVID negative. It takes a period of time. We don't know what time that is. So they need to go into a transitional facility. We've identified 2. We need to work with State DOH to confirm they're okay with both of them. Once they are okay with them, we will announce who they are. But again, 77 in the hospital. That number's been going down by itself. You take out the 44 folks that don't need to be in the hospital anymore, certainly in excellent condition with our hospitalization infrastructure, and we're in better shape today, the last day of Phase 1, than we were going into Phase 1. 14 individuals in critical condition. Again, that number a little bit on the lower end of where we've been over the last month. That's good, but we need to remember these folks, think of these folks, pray for these folks, as critical condition is you're in a real fight with this virus, and so we need these people to get better. 46 folks who are in the hospital, Caucasian, 19 African American, 7 of another race, and 5 have declined to share their information with us. To date, 240 people have been released from our hospitals, so very happy about that. Again, 1,992 positive cases, up 19, very good number. Had a very good number yesterday, another good number today. Let's hope this is a new trend. It's still too early to talk about this like it is a new trend. But 3 of the 19 household contacts, again, a household contact is an individual that lives with a COVID-positive patient, resident of ours. They pick up symptoms related to COVID, many symptoms, not just one. We then determine that they're COVID positive. We anticipated this. This is not a threat to the community at large because these individuals are already in a quarantine, and they pick up symptoms throughout the isolation period of the COVID positive resident. 7 of these cases are affiliated with senior living facilities, essentially staff of nursing homes, asymptomatic. A challenge. We don't know enough about these cases. We have to presume that they are contagious, so they go into an isolation just like everyone else. The very good news here is I don't believe any of these 7 are residents of nursing homes, and that we're seeing a trend now, a downward trend of positive cases within senior living facilities. Why is this so important to the community? These are the cases that become hospitalizations, which then a percentage becomes ICU, and then a percentage of those folks we lose. So seeing this number go down is really critical. Very happy about that. So we take our 19, we have 3 household contacts, 7 related to senior facilities, 9 community spread, another very good community spread number. So happy with that. We're presently monitoring 822 active cases. 1,045 individuals have recovered, and we now have 1,905 people in isolation or quarantine. Asymptomatic cases, again, this is a trend we're now seeing. 53% of our cases over the last 3 days. Again, we've had 3 straight days of light cases, many of those being employees at senior-related facilities testing asymptomatic, but it's a trend. We need to just recognize that there are asymptomatic people in the community, so be smart. You know what the right things are to do. Protect yourself, protect your family, physical distance every time you can, and we'll get through this and we'll continue to make progress. Out of our cases, 1,181 have been female, 811 male, 89 under 19, 334 in their 20s, 247 in their 30s, 247 in their 40s, 318 in their 50s, 257 in their 60s, 196 in their 70s, 185 in their 80s, and 119 in their 90s. Geography, City of Syracuse, 1,104 total cases, 531 recoveries. Clay, 156 cases, 107 recoveries. Onondaga, 133 cases, 38 recoveries. Geddes, 105 total cases, 30 recoveries. Salina, 86 cases, 57 recoveries. DeWitt, 74 cases, 55 recoveries. Manlius, 72 cases, 55 recoveries. Cicero, 64 cases, 38 recoveries. Camillus, 62 cases, 38 recoveries. Lysander, 37 cases, 28 recoveries. Pompey, 26 cases, 22 recoveries. Van Buren, 27 cases, 9 recoveries. Skaneateles, 15 cases, 15 recoveries. Lafayette, 7 cases, 3 recoveries. Marcellus, 7 cases, 6 recoveries. Elbridge, 5 cases, 2 recoveries. Otisco, 5 cases and 5 recoveries. Spafford, 3 cases, 2 recoveries. Fabius and Tully each had 2 cases and 2 recoveries. A couple items related to restart that we've talked about or we're getting correspondence, and then I know I'll have questions on this topic, so we'll leave some of the conversation to questions. Again, we talked yesterday about outdoor seating at restaurants. Let me explain the process. We are not talking about outdoor service at restaurants. A restaurant that does that is in jeopardy of losing their liquor license through the state of New York. The state of New York will make that decision. What we are talking about is the reality that there are seating outside at various restaurants. People are doing this anyways. When people are doing something, it's better to give the business owners guidance to keep their consumers safe and to keep their property safe in a way. So Dr. Gupta will be giving guidance. I will be doing an executive order to give guidance to these restaurants. This does not mean you go out and buy 10 picnic tables and put at your restaurant. That is against the intent of this, and that is not what we're talking about. We're talking about seating that is already in place, and you have a patron who goes, buys a meal. Instead of going home or going to a park or a bench, they sit at the bench that is on your property, right? So that's what we're talking about. So all you businesses out there that don't understand what we're talking about, now you do. But this is, we'll give this guidance out through executive order, and we are not talking about restaurant seating where you have full service. We have advocated for you to New York State to include that sooner than phase 3. The New York State has not told us they are allowing that at this point, or if they will allow that. Once they tell us that, we will communicate that. So please be careful. Your liquor license, for many of you, is your livelihood. Do not risk that. Another call, many calls, emails that we received today related to graduations. Let me explain our role related to graduations. We do not approve graduation plans. We do not tell the superintendent and the elected school boards how they should do graduation or when they should do graduation. They're elected, they're superintendents, highly educated individuals that can make this decision themselves. We have been asked to give guidance on how you can do things today in a safe and healthy way. We have given that guidance. That guidance may change when the facts on the ground change 2 weeks from now. So to the parents who are upset with the decisions that their school districts have made, I did not tell them they have to have graduation a certain way. That's not what we do. I have not personally reviewed a single plan from a single school district. and gave it a thumbs up or a thumbs down. That's not my role. Our role is to give guidance on how you can do things safely in this pandemic on this date of May 28th. And as the date goes on and as the facts on the ground change, we will update the guidance. So I had many parents confused by this today, calling in, upset at decisions their superintendent may have made or their school board made about graduation for their senior class. And I am highly sympathetic towards seniors, and I want them to be able to have a memory as they exit and they go on to the next stage of their life, because I want all of them to come back to Onondaga County when they're done, and I want them all to live here and raise their families here. The best way to have a more interactive graduation is to give more time so we learn more about this virus. So certainly there's the potential to do different things in July and August that you probably can't do things in mid-July or mid-June. So again, clarifying, all we've done is we've given guidance that was asked of us to the superintendents about safe ways to do things based off of the current executive orders by New York State, best practices by CDC. We did not make any rulings on any graduation plans whatsoever. We did not approve them. We did not deny them. Those plans will be decided by your superintendent and your school board. So if you don't like those plans, please take them up with them and have a conversation with them. Child Care Solutions, again, daycare for our essential employees going into phase 2 tomorrow, 315-446-1220. If you have gaps in child care, please reach out. We've worked very hard to put together these slots to make sure that our essential employees could remain at work as we fought through this pandemic. We realize there's still a period of time now where normally your children would be in school, and now you have a daycare gap. We're helping fill that gap. And again, 211 for social and emotional support. This has been a very tough process when we're talking about people's health and the reality of the loss of life, liberties being postponed in many cases for us in different ways. This is all new. We've never gone through it. If you need help, please call 211, talk about it, get referrals as we get through this together. Questions?
I just want to clarify the deaths quickly. You mentioned 2 hospital deaths, but it sounds like the total jumped 3. Does that mean there was 1 nursing home related death reported by the state?
Must be. Yeah. Yeah, we gave a total. So, yeah, again, we don't, we get the numbers same place you do. So, yeah.
And the total, just to remind everyone,
130.
But it's the state nursing home number plus the county's hospital deaths number.
Correct.
So, Ryan, we're starting phase 2 tomorrow.
Yeah, it's 14 days. The data is better than it was going into phase 1. I think we haven't heard any inclination from the state that we weren't. So,
but have you heard from them that you are? I guess there's this confusion that, Cuomo hasn't really mentioned it. We still haven't seen guidance for businesses from the state. So have you gotten an indication that yes, we definitely can do this, and here's what it's going to look like?
Yeah, Chris, the only way I can answer this is I've not heard from the governor saying phase 2's tomorrow, right? Nor will I. But there were rules that were communicated. It's a data-driven process, and the data says go. So the guidance, the delaying guidance is probably, there was a change in the governor's presentation today. More specifics were given in what phase 2 is going to look like. I think they're probably working through that guidance. Maybe the guidance has gone out as we've been talking now. But with our representatives from the state, all week long, we've been planning and preparing for tomorrow. There's no reason not to go tomorrow. So this is where we get in a position where there's a lot of frustration with who is going, how they can go. We need to get better at this as a team. We're all a team. We've never gone through this together. We never had to do this before. But to suggest that we're going to change the rules from phase 1 to phase 2 now, it's just not going to work.
I'm not suggesting we change
Yeah.
the rules, but I think the confusion is when phase 1 started, there were steps that led up to it. The governor came to town and said, you're in for phase 1, here's the green light. There was guidance issued to businesses a couple days before, and we've seen none of that for phase 2.
Yeah, well, the guidance came very late. It came, for us, it came 24 hours to a test. So we're essentially in the same boat right now as where we were in phase 1. So I would say, that, to your point, it was different. The governor came into town. Very happy to have him in Onondaga County that day. Gave great news. Some of you were there. And this wasn't, it's not going to happen every time rolling out. He was in New York City today, so he wasn't going to be here. But there's been nothing, what we've been hearing from the state is, yeah, getting ready for Friday, waiting for the guidance, and the data speaks for itself. So we can't, the business is ready to go, can't wait longer. They got to be ready to go to work tomorrow. So that's kind of where we are is, and I'm sure the guidance is going to come out any minute when we're here. But we have to, moving forward, we have to be better going into phase 3 with guidance. And there's going to be a lot of disappointed people who have been in this in between phase area that didn't make the cut for phase 2, and I understand the disappointment. I wish I had the ability to make that call and make that decision. I don't, and but as far as specific businesses go, and so I know there will be disappointed businesses. I will continue to advocate if we believe you can operate safely, and I will continue to push that using my voice and my platform for that, just like I have this whole process. But there certainly, we have to do a better way transitioning into phases with communication with the business community.
You've indicated that you have access to state leaders in your daily phone call. Are those state leaders equally as confident as you that phase 2 is a go tomorrow?
Yes. Unless somebody told them not to today. It's kind of, there's no way to say we're not going to phase 2 when you look at the information. There's just no way to say we're not. So everybody's been preparing for this day. In the call, it's all been, data's good. I'm going to get you an answer on this question. I'm going to get you that. We haven't had our call yet today. Our call's later tonight. And so I wish I had more concrete information for the businesses, because I feel horrible for the businesses that are in limbo right now. Many of them know, and they're getting ready, and there's presumptive ways. Everybody can figure out what you got to do with PPE and physical distancing and working that for the most part, for the ones that know. For the ones that are a blend of phases potentially, they need the specific guidance from New York, especially the businesses where State Department of Health licenses them. Dentists. I don't know where dentists fall. Now, I know this. I know if you haven't gotten your teeth cleaned in 3-4 months, everybody might be considered an emergency, in a couple of weeks here. So I know that some of these practicality things are happening, but I don't know where massage therapists, we've been hearing a lot from. I have no clue where they fall. And so we're anxiously awaiting, and I feel very bad for these business owners who are they need to get back to work.
But in the absence of the governor publicly saying anything about this, you get confidence from the state leaders you talk to who are in touch with the governor's office that phase 2 is a go.
Yeah. Nobody's ever said phase 2 isn't a go for Friday. Everybody's been talking about Friday since we got to phase 1. So now Friday's tomorrow, phase 2.
I'm looking at the state website and I don't see guidance yet. That may change by the end. I don't know. But what do some of these businesses need to know if they plan to open tomorrow? If they have to attest to something still?
Yeah, you gotta attest, and you go online and attest. Masks are going to be part of this. Sanitizing, hand sanitizer being readily available are going to be part of this. You got to keep your employees separated 6 feet. These are all things you already know. We've been living this, right? So be prepared for that. I think on the slide today from the governor, barber shops and limited barber salons, again, I don't know what they're thinking about there. I'm going to let them clarify that. I know that barber shops and clippers, there's no limitations on clippers, so I think there's certain aspects that they got to clarify on that. But back office, all back office is now there. That's a change, I think, for the positive. If you're a business and you have a back office, to me that tells me you got some flexibility there. So we're going to know soon because they got to come out, because our region isn't alone. Every other region in the state who's been in 14 days, their data has improved. Tony Pacenti talked to Mohawk Valley. Their data has improved. Same thing. The businesses have been chomping at the bit to get going. People are going to get going tomorrow.
But for hair salons that have appointments, probably in the morning, they're waiting to attest on this document that isn't out yet. What do? Do they wait to attest, or can they accept customers tomorrow morning, hoping the guidance comes eventually?
Yeah, I think you're going to be in a situation where this is going to be up by then, but if it's not up by then, it's going to be up tomorrow. And then you're going to have to be at work, and you're going to have to take some time and a test. But certainly, I anticipate many of these businesses' doors will be open tomorrow.
One of them is Destiny USA. They said they're waiting for the state to give them the green light. What would you have to say to, big places like that?
Well, if they're waiting for the state, they'll wait for the state then. That's their call. Yeah, so that's, again, retail, phase 2, in-store retail's open. Many retail stores in that building. You can't think about this. So the word mall, what do you mean? Indoor mall? Strip mall? What do you mean? If you're not going to allow mall retail, that means there's not going to be any retail open, because Fairmount Fair, Town Plazas, strip malls, they're all malls. So these are all things that, again, retail is retail, and if Destiny, that owner wants to say, I want to hear from the state directly, then they got to work that out on their own terms, because they could be waiting a little while.
So, hypothetically, if guidance doesn't come tonight and we get into tomorrow afternoon and there's no guidance, are you advising businesses to reopen and then wait for the guidance to come?
Chris, if someone says at another level of government that Central is not ready for phase 2, there's going to be a serious disagreement. And then I don't know how that could happen. I don't know how possibly that could happen.
I'm not necessarily saying we won't be in phase 2.
If there's no, this gets to the point that if nobody's communicating and phase 2 is supposed to start, that businesses will open up no matter what I say or what the state says. There's been a good process as far as how restart begins. The guidance, we got to do better, right? But the process of how you go made sense, and it was a data-driven process. So if the data is still good, it doesn't matter what I say. Businesses are going to say, how is this possible? Of course we're going to go look at the data. So I think you're getting to the point that if you want to deviate from the process, mid-process, there better be a really good explanation, or else businesses are just going to do what they're going to do.
But what you say does matter to some businesses, and in the absence
Andrew, you lose credibility from this microphone if you say these are the rules, and you follow the rules, you do everything you're supposed to do, and then the day people reap the benefit of the rules, you say, I'm changing the rules. I don't come to this microphone anymore if I do that, because I've lost all credibility. So it doesn't, if you change the rules on right now, and I'm not suggesting that's what's happening, but this is a hypothetical conversation we're essentially having, then I lose credibility.
But aren't part of the rules attesting formally and having that posted in your business? And they might not be able to do that when they open tomorrow.
If you change the rules midstream in a way that businesses think is unfair, you're probably going to have businesses opening up because they were treated differently. That's just the reality of this. These businesses have been waiting for weeks, no paychecks, nothing. Many of them can't get unemployment. And so, to my point, no one in the state has said, we're not going tomorrow. And I know this is kind of fun hypotheticals at this point, but you aren't going to look at our data and say, we are in a distressed situation with COVID-19 in this pandemic. Right now, we are stronger than we've ever been in this pandemic. And so to then say to the businesses that need to feed their families that we're going to change the rules literally at the last hour, it's not going to work out well. That's not what can happen. So I think everybody, the hypotheticals are nice, the what ifs, but we would have. I'm highly confident if the state of New York was going to change the rules, they would have told us by now. Not let me come out here today and talk about this with these hypotheticals with you.
So they did change what's on the PowerPoint today. Do you have any explanation?
I think those were
for that?
clarifications, though. I'm going to give those are broad themes. I think those are hunkering in, honing in. To me, that tells me that they've put out guidance on some of those industries, and when they come, we were told they were going to be up last night, and then if not last night, this morning. We're here this afternoon, so hopefully momentarily.
What's your plan for county offices? Now that office space is allowed to open, are you increasing your in-person workforce at all?
The Civic Center was really not built for physical distancing, so we're going to continue to assess our workforce and who can continue to do their jobs from home. We encourage other people that have the same challenges to continue to do that. We will not be coming back to full strength in the Civic Center anytime soon. If we win this round with this pandemic and there's no more cases in 3-4 weeks, then we'll reassess that. But I can't have 100 people sitting waiting for an elevator. There's only 6 of them every half hour on during the day, throughout the day, and that's what happens in our building. So we have to thin out the density, and so that's just that's one of the internal realities that we have as an operation.
Any capacity increase with phase 2?
We'll look. We're assessing. We brought back some contact tracers, specifically going into phase 2. One of the things we're going to be ready for is we were preparing for an uptick in cases in phase 1. Didn't really happen. Phase 2, we're going to prepare for an uptick in cases, so we'll have more contact tracers ready. But besides that, maybe a couple adjustments in a department here or there, but a lot of folks working from home still.
For these industries that are in limbo, you've talked about like personal trainers, you just mentioned dentists, a few others. Are you getting an indication one way or another of where the state is leaning, or are you learning about what's okay at the same time the rest of us
I think so. The new slide on phase 3, I think it was personal services. Maybe there's a new category. I learned about that. I have a feeling I'm going to have frustrated people tomorrow that are going to fall into that phase 3 slide. And so I think when you're a dentist and you're assessing your client, your patient, you haven't seen them in a long period of time, you don't know what you're going to find. So you could have an emergency there. So they're going to have to make some judgment calls with their patients and whether or not they can come in and see them rather than a root canal. You don't know what you have now. Think about it. If you haven't seen your dentist in 9 months, plus you're supposed to go see him, and then 3 months now, you got pain in your mouth. You don't know what it is. So I think there's going to be, these professions are going to have to make, especially these licensed professions, are going to have to make judgment calls on their own for the best interest of their client and their patient in this case. So I'm concerned that dentists aren't going to be going in phase 2 based off of what I saw on that slide, but I don't know that information.
You're approaching, Onondaga County is approaching 2,000 total confirmed cases, and the city has more than half, which isn't totally proportional population-wise. What would you attribute that to?
Purely buildings. nursing homes. Point blank answer there. There's nothing else there. That's where it is. If you take those out, they might even be running behind their percentage of population.
Ryan, you've got a proposed tax on energy consumption for residential buildings. Just curious how you think that's, I know the county is facing a revenue shortfall, but how you can justify adding a tax to homeowners right now, property owners right now, who are also hurting.
So here's the situation, and it's a discussion between us and the legislature that impacts the city of Syracuse and the county of Onondaga. We are looking at over a $100 million deficit, a $1.4 billion budget. So internally, we have cut $25 million of spending. Any flexibility I have or the legislature had has been cut. We have a retirement incentive to get people to retire early so that we can save those positions for the last half of the year, essentially. We have frozen a certain number of positions that were funded vacant positions. We have cut over 200 positions down to 0 hours that were part-time employees. We were told we had to shut down. We're discussing something right now. If it was my decision, and these decisions in phases affect our budget. If it was my decision, I have the best health department in the state of New York. I have the best health commissioner in the state of New York. We do things right. That's why our numbers are where they are and why we're able to talk about this. I ask her, what can we do safely and open up in a safe way? And we have these conversations. We would probably be making some different decisions right now. But I don't have that. So on top of this $100 million hole, mainly because we had to shut down our economy, so it wasn't our fault. The state said we had to. The federal government agreed. We need help. And the reality is, I don't have time anymore to start making round 2 of bad decisions. So we're at the point where the federal government is not moved yet on a bill. We don't know if what they do will be enough. And then on top of that, we have the state of New York saying we will cut you 20% if we don't get what we need from the federal government. So that 20% to us is, I think, $30 million. On top of my 100, it could go to 130. So here's the decisions we have to make. If we don't get help from the federal government, we'll have massive restructuring in county government. It will be massive. We have no choice because we're mid-budget. We have no ability to generate revenue, except we found one way to generate revenue. And that was, we're one of the only counties that somehow does not get sales tax on energy. So the decision is, yes, in that role, people of this community would be paying more in their energy bill. Many of the low-income individuals in our community and people on fixed incomes get HEAP. They don't pay their energy. They get help. So when you look at all of this, the only way we can generate any real revenue is through this metric. So we're having a discussion with the legislature. We can cut and cut and cut, but there's no way around cuts in these restructuring where the services that people want and expect don't get touched when you're looking at a hole like this. If we have to restructure every department in county government, we'll get hurt. That's your law enforcement. That's your healthcare workers. That's your CPS workers. That's the people who work with adult long-term care, people who plow your roads. That is the people who run your parks, the people who run your jails. There will be no department that is not hurt by this. So on a temporary basis, do you implement this sales tax, which we should have already been getting, quite honestly. We're one of the few counties that doesn't get it. So that's the decision. If we get this revenue, that will save jobs. And then if we get federal help, that will save more jobs. That still doesn't mean we won't have to restructure. And I can tell you, if the state cuts us, we're going to have to restructure. So that's the reality where we are fiscally. And so as a community, when you need government, you want your government to be lean and efficient and on time. Our ability to do those things will certainly be lean. Efficient will be challenged, and on time. If you need us on time, and we have to go restructure all of our services, public safety services included, we may not be on time. So that's what happens when you're in the middle of a pandemic. You have a $100 to $130 million hole, depending on what the state does, and you have decisions to make. We've already cut what we can. We've already done the things we can without restructuring our entire workforce. And if we don't get federal help, we're going to have to do that. And then if we don't get state help, we're going to have to do that. And the only revenue that we could potentially get is through this sales tax that, for some reason, we haven't been collecting over the last 20 years.
The governor had an executive order today about wearing masks and that businesses can essentially not let them in if they're not wearing one. How is that going to be enforced here locally? Are you guys talking about that?
Yeah, the business is going to make that decision. So the businesses can do that. It's good business practice. People get nervous when people don't have a mask on, especially if you're in the small corridors. I know Tony Pacenti in Oneida County had this order a couple weeks ago, and he did it. So we're not going to be able to police this. Again, to the point we just had, you can't say you're going to cut us 20% and you're going to go enforce all this stuff at the same time. It's very hard. This gives the businesses the opportunity to say to a customer, put a mask on or don't come into our business. That's what it does. There's not a role for us in this process.
Do you have any update on religious services?
Not yet. Certainly, I know and talked to many of them that believe the president is right. I've talked to some of them that believe the governor is right. So we are getting to a situation where we don't want to be in. So I think I know there are religious institutions that are getting ready to have services full-blown, full services, and I know there's some that are going with the governor's guidance. So that's why if we can find a middle ground, which is what we proposed, I think everybody would be better off that way under the mindset of public health. So we'll hopefully have more news and certainly be able to talk tomorrow about what kind of advice we could give to people.
What's the update with the sewage study?
So, wow, a good question. This has been, we've been looking at wastewater, the sewage, your COVID-19, you can track it. You can't get it through sewage, but you can track it. Where we see the value in this isn't right now, but what we are hoping is that the scientists who we've partnered with will be able to develop a way to track the intensity by wastewater treatment facility. We can compare that with real data right now to fact check it. And then in the fall, we're testing. We believe we will see it first in wastewater. And then we know, okay, we have COVID in this wastewater system. Let's go put our mobile testing facility out in this community. Let's go do as much testing to try to find this, quarantine, trace, isolate. And so that's kind of the thought process. They are fine-tuning this. They have found COVID in each of the areas, but my understanding is they've yet to be able to figure out the intensity of the COVID where we could then match it with our existing active cases and really fact-check the test. So really good potential there. I don't think we're quite there yet where we can use it as a tool. Gotta love those questions, though, on sewage. Other questions?
Why was your regional call delayed?
My guess is it was delayed because you have County Executive McMahon, Chairman Becker, Chairman Hyder, Chairman Weatherup, Chairwoman McNabb Coleman, Mayor Walsh, all wanting to know where this guidance is. And so my guess is that got pushed back because the guidance wasn't quite ready. but we're going to have a great call. I know it, and remember, we're all learning this. This is frustrating because in my case, as you've seen with graduations, we give guidance. People think I'm saying yes and no to everybody's favorite ideas about a graduation ceremony. We're involved. The local government does not have control over some of the clarifications here. We didn't pick the phases. The state's picking the phases. We're giving input. That input we think is being heard. Often we don't know if it is or isn't. But I wish I could answer some of these questions. And I'm getting them all, trust me. And I can't, and I feel the impact of this pandemic on these people. People in tears calling my office, wanting these questions answered because they don't have money. That wears on my team. That wears on me because I know the advice I could give them and how they could operate safely. And so this is all happening. No one's ever had to do this before. So it's not like there's a perfect way to do this or anybody has all the answers. But we need to do better. Overall, all of us, we need to do better. And if we do better, then that will help us be stronger through all of this. So I get it. I think the call wasn't ready because the guidance wasn't ready. That's what, to be transparent, that's where that's my assessment on that. Other questions? Okay. I want to thank the Downtown Committee. Timely for Phase 2. They are getting up our hanging flower baskets as our downtowns come back to life. So I want to thank Merica and her team. Also, some of our friends at the Red Cross are in need of blood donations. I've had people reach out to us. So please look at the Red Cross. If you can donate blood, please consider that. These are trying times, and certainly we need to support each other every way we can. So please consider that. And again, to all of our graduates and our seniors, you've been through a lot, and we want to have the proper send-off for you. We're proud of you, and we're proud of the things you're going to do. And you're going to all come home and living out of that county when you're done. So I just want to give you all, our seniors, a shout out again. You've had something taken from you, and you're a victim of this process, and we recognize that. And we'll get through this, and you'll tell your grandkids about this someday. But other than that, we're making progress. I want to thank everybody, thank the community. We march towards Phase 2, and hopefully we'll continue to be smart with physical distancing and mask wearing, and we'll continue to see positive results in our fight with this virus. So thank you.